we have the advantage in the new era of medicine of having highly sophisticated testing that can take nutritional analysis to a whole new level. The comprehensive digestion stool analysis from Genova is one such test. You know, for people with chronic GI issues, bloating, gassiness, diarrhea, cramping, etc., this can be a real game changer in identifying inflammation in the gut and identifying leaky gut, allergies, and occult or subclinical infections that have been lingering for a long time. Those are all key aspects of this test that make it worthwhile. Now, this kit is going to be shipped out from Genova or our office directly to your home. And with any of our testing, the requisition is the key piece for you to pay attention to. Again, the back of the sheet is more your responsibility as a patient. We need all patient information filled in. Your insurance information goes here. Make sure that's completely filled out. And if needed, check or credit card information and a signature down below. Now, how do you know if you need to pay anything? Well, that involves looking into the Easy Pay Insurance Billing Guidelines, which will tell you whether or not your current insurance is Schedule A or Schedule B. Schedule A is more favorable. Your insurance company is going to cover more of this test. If you're Schedule B, make sure you contact our office because we can often give you a more competitive cash price that we've negotiated with Genova and save you a few bucks if you're Schedule B. The requisition completed has to go back with the box to Genova. Now let's open this up and get familiar with it. Unlike any other test, you really are responsible for the collection and the return of this particular test. So inside, the key things for you to focus on are, number one, you have a specimen collection container. There are some gloves in here too, thankfully. And we have two vials, one pink on top, one orange on top. The orange one has a red solution in it. Okay, that's how it's supposed to look. There's nothing wrong with that solution. And then there's a green top that has a clear solution in it. And then there is a clear, empty container with a screw top. Okay. Now, once you have collected some specimens, some stool, you're going to, out of that stool collection, you're going to use the spoon that's built in here to scoop some of the stool into each of these containers, doing the orange, the green, and the pink. Now, there is an instruction sheet inside that will walk you through this step by step, but we thought it'd be helpful to shoot a video to make you more familiar with it. So once you've collected some stool with gloves on, then you can take your spatula and collect more stool, and they want you to fill the clear container up to the 40 ml mark, which is about right here. Okay, so enough stool goes in here to collect that. Everything's sealed up, all right? And that's your collection right there. Now you have some of the remaining specimen, and inside the box you're going to find a black waste bag that this goes into. It seals at the top, and that goes into the garbage. All right. So if you have these 4 collections, make sure the tops are sealed and they're labeled on the outside. Each one of these has lines for putting your name and date. Okay. All 3 of those go into a biohazard bag. They're refrigerated. They're placed into the box. It can be done after a couple hours of refrigeration. And then the whole box is placed into this FedEx return large envelope and dropped at a FedEx center or in a FedEx drop box.